Good afternoon, Dr. Upadhyay, eminent panelist, ladies and gentlemen. I represent MDG Health Alliance in India. MDG Health Alliance is an initiative by the United Nations Secretary General's Special Envoy for financing the health MDGs. It works in partnership with NGOs, private sector, governments, academic institutions to help achieve the MDGs, health-related MDGs. Let me take a minute of time on just introducing what the MDGs are, health-related MDGs, which we are focusing on, and then I would like to continue from where Praveen had left. We specifically focus on MDG 4 and 5. MDG 4 relates to reducing the child mortality. Currently in India, there are about 1.4 million children who die each year before they achieve the age of 5. This number needs to be brought down to 1 million by end of 2015. Less than 800 days to go, and we are not on track to achieve this. Current CAGR for achieving this is roughly about 3%, and what we need is upwards of 14%. So that's MDG 4. Similar figure is for MDG 5, which relates to maternal mortality, where we need to reduce the maternal mortality from 56,000 deaths per annum to 42,000 per annum by end of 2015. These are two MDGs. But now let me bring the attention of the group back to where we started in the morning and where probably Praveen and the other panelists led us to. So first, I want to emphasize the importance of healthcare and why private sector at all should be considering this. And I have a slightly different view to this, which would be interesting for the corporate sector in particular. So let me start with a macro view, which is by giving an example of some of the East Asian countries which have done well, whether it is China, South Korea, Malaysia, or Thailand. They have grown phenomenally well over the last 20 years. But 20 years before, which is 40 years from now, they invested in healthcare. If we look at the latest World Bank research, it clearly shows a correlation between reduction of mortality rates for children and mothers in those countries which happened over the last 20 years, following which the economic growth happened for that. So that is like a view from 20,000 feet above. If I'm talking about growth for India, first I need to address health as an area. Second, specifically for the companies here. Some of the companies that are present here are here because they see India as a market. Some of the companies that are present here, they see India as a source of talent. Now, whether it is India as a market or it is India as a source of talent pool, the one thing that attracts any company to India is the fact that India is a young country. And by over the next 7 or 8 years, we would be the youngest. 64% or so of the population would be below the age of 30. But if we look at the figures for children under the age of 2, there are 60 million or 6 crore children who are stunted. This is half the population of, half the total group of children who are under the age of 2. So out of total children which are under the age of 2, half of them are stunted. And this, by the way, is 30% of the total group which is worldwide. Now just imagine what kind of talent pool will we have 7 or 8 years from now. Because this is not a one-year situation I'm talking about. This has been there in the past. So from a company point of view, as you would scout for talent, what kind of talent would you get? And by the way, in terms of returns of investment, in terms of for the talent, the returns keep diminishing as the age increases. So research has shown that the first 1,000 days are extremely crucial to reverse the mental and physical effects of malnutrition. Once the 1,000 days are gone, there is very little impact that happens. So if we are not acting right now on malnutrition, the fact that Praveen was mentioning in the beginning of this session, the fact is that we will be left with a young population for sure, but the quality would be questionable. So it is the interest of businesses to start thinking now that if you are here or if we are here for the next 10 years, we are creating businesses for the next 10 years, we can't ignore this fact that the quality of population is suffering because of the fact that 6 million population of children under the age of 2 are stunted. So that's just one example. But in terms of the other causes as well, they are highly preventable. So out of the 1.4 million child deaths that happen every year, 43% are due to pneumonia, and underlying causes is malnutrition. Then there are about 10% which happen due to diarrhea. And again, both these causes, if I look at, then the reasons are not something that cannot be prevented. So that's point one, that the importance of healthcare in the economic growth, in the growth of corporate sector as such is paramount. We can't ignore it. We can say that it is the government's job. Yes, primarily it is the government's job, but given these indicators where the figures are, government alone is not capable of handling it. So that's why private sector needs to come in. So that's point one. I think the second one is now with the CSR law, companies would be starting to think of, those who have not been doing, some companies have started thinking of. So what are the different models that exist? How should I think about? If this is the kind of question that a corporate has, then there could be three ways to look at it. One is companies which are well placed, well aligned with their products and services which relate to healthcare. So pharma companies, medical devices companies, hospitals, allied services, etc. They can start thinking of a different kind of audiences. So up till now, my target was top 30 cities or top 50 cities because that's where the affordability for my products is. But now, if the goal is not only economic value creation, but a shared value, which I would say that on one extreme, it's only about making more money, and on the other extreme is the social impact. Somewhere in between is what we call shared value. So if the objective going forward is shared value, then my target audience would change for these kind of companies. So a good example is what Novartis has done with the Arogya Parivar, where they are now reaching to roughly about 42 million people with a customized set of products, customized set of distribution, educating people about diseases and their prevention, linking up some of the healthcare providers with the microfinance institutions, making sure that there is this whole healthy ecosystem that gets developed in those hard to reach places. Similarly, what Unilever has done with their whole Swasthya Chetna program related to hygiene, and which, by the way, not only helped increase awareness about diarrhea and basic hygiene, but also helped Unilever's product Lifebuoy gain 20% of the market share. It is a 1,000 crore brand now, but not before Unilever changed its tactics and said that I need to create a shared value. I not only need to look at my profits, but I also need to look at what social impact am I creating. They could have very well said that, okay, let me take the CSR route completely, and maybe the packaging of Lifebuoy would be through biodegradable products or paper or something like that. But they took a very different approach. They said that no, the way I need to go about this whole issue is by looking at the problem which is there in the society as such and the role that I can play through my product or service. So that's example one, which is if the corporate is present in any of the related areas, this is how they can bring an impact by changing the target audience. So your target would not remain the highly affordable people, but much below that as well. So that's example one, which is model one. Model two is what I would call as through social and philanthropic activities which are creating some sort of impact in this direction. So let me explain a little bit more here. So it could be either funding a research institution which is in this line, it could be either through giving access to the infrastructure that you have, which could be either your supply chain, which could be either your premises, etc., to organizations which are already working here. So these are like two other examples, but there are multiple others. But this specifically relates to those companies which are not directly into healthcare, but still would want to contribute. An example here is BBC Media Action. So BBC Media Action came out with Mobile Academy and Mobile Kunji in Bihar. Now again, if we look at the partnership, BBC Action Media is working with the Gates Foundation, they are working with Pathfinder, they are working with On Mobile, which is a mobile VAS company, they are working with the government of Bihar. So this partnership as such is multi-stakeholder partnership. BBC Action Media, being a media company, could not have moved a needle on its own. So first the starting point was, how do I create a multi-stakeholder partnership that can create an impact? And me being a media company not directly related to healthcare, I can't do everything on my own. So their starting point was creating a multi-stakeholder partnership. What did they do? Mobile Academy is a training module which is very easy to use for the frontline health workers. The basic problem that they were trying to address was that for a frontline health worker, generally the training programs are quite long and there is no follow-up, number one. And second, there is very little of interpersonal training that is provided in those programs. So Mobile Academy is a 2-minute module per module kind of session that you can access from your mobile phone. In terms of demographics, while in the state of Bihar, you would find only 18% people have access to TV. Almost every ASHA worker, which is a frontline worker, has access to mobile phone. So that was an insight for them that we are not going to go with an advertisement only on TV. We are going to use a medium which everyone uses. What is the result that we have as of now? So as we speak, there are roughly about 2.7 million minutes of that content that was downloaded by not only the frontline health workers but by the community as well. There are about 100,000 unique users every day that access this content. This includes the ASHA worker, this includes the family which is able to hear about the 10 life-saving behaviors for the children on an audio. So now again, only a private sector could have thought about this innovation. Only a private sector could have started thinking about different collaborations that are needed with the government, with the NGOs, and only a private sector could have brought about a stringent monitoring and evaluation system, which by the way was a crucial success factor for them over the last 1 year. They evaluated how the ASHA workers reacting, how the families reacting. Is there a positive direction that these stakeholders are taking towards child care and maternal care? So while 1 year back, mothers used to say that child bearing as well as delivery is something that I am responsible for. Now this is a very specific nugget that I'm sharing about the community. They said that what is it that the government should do? This is completely my responsibility, and hence they completely shunned the idea of institutional delivery. They, in case of breastfeeding, they felt that exclusive breastfeeding is not required because people in my community would say that I am not giving enough food to my children. Now these are some of the behaviors that had to be changed through an innovative way. So, which means that the company could not have done it on its own. It had to rely on someone within the community, and which is where the community health worker comes into place. But then they also had to think of an innovative way which is interesting enough for the audience to listen to it, and that's where they came out with this kind of an approach. And now in the 8 districts where it was piloted, apart from the facts that I shared about the minutes of users and the unique users, there is an increase in the institutional delivery as well. Because the behavior that were being talked about by a fictional character, Dr. Anita, on that mobile phone, she spoke in a very interesting colloquial way about which behaviors are actually useful for you. So a doctor telling it had a far greater impact than an ASHA worker telling it. But for the ASHA worker herself, it is a great booster to her morale as well as her reputation that she is the one who carries a mobile doctor. So again, the point that I wanted to emphasize through this example is that BBC Action Media, not a healthcare company, it is not related in any way to healthcare as such, but their focus was how do we empower marginalized communities by forming a multi-stakeholder partnership. So that is the second model where companies are not directly into healthcare, but still they can form multi-stakeholder partnerships. I think the third example is when you do not fit in the first category, you do not fit in the second category, but still there's a role that you can play through policy advocacy and stakeholder engagement, which is around, there are a lot of issues where a private sector organization or NGOs also can act as convener of different parties. So issues related to vaccination, issues related to protocols, treatment protocols, that's where a lot of awareness needs to be created, not only amongst the peer groups, audiences, but elsewhere as well. So that is the third kind of model which I would think of that you could adopt when you're thinking about partnership. So I think these are the 3 models that I wanted to share which can be thought of. I think lastly, if I want to leave behind a thought around what are the success factors and hence what should be the roadmap between now till say 1st of April as you form it, I could think of there are 4 key factors that are important for any corporate to think of how do we, for corporate first of all and then NGO and government separately. First, from the corporate point of view, as other panelists also shared about, anything that you're thinking about has to be around the core competencies of the company. Because if it is outside the core competencies, whether it is skill sharing, whether it is product and services, or it is policy and advocacy, if it is not your strength, believe me, you will not do it after 6 months. It might be here, it would be there in the initial 6 months of discussion, but after that, as the person who was championing he shifts, that idea will go. So first of all, any idea, it needs to be generated through a good reflection on what are the core competencies, what do we stand for and what is it that we can hence contribute. Second, success factor in all these examples that I have seen is the stakeholder involvement. So in most of the successful examples that I have shared, it is the top level management which was an important stakeholder. So as we talk about the CSR committee, we need to make sure that the CEO gets involved. Arogya Parivar promised to the top management that we would be breaking even in 30 months. So, think of what works for your particular company, but it is vital that the top management gets involved. So that is the second point, which is the stakeholders alignment. Third is, what is your strategy? Who are your partners for the areas that you are interested in? Who are the like-minded partners, if I were to use a better term? And these partners must consist of government, NGOs, and yourself. It could also have academicians, but it must consist of government and NGOs. Government for the simple reason that you might start a pilot in certain districts, but if it is not bought by the government, the whole idea in the pilot, then it would remain a niche kind of idea working alone in certain districts. If the idea is to create social impact, government needs to be involved because government is the one with all the funds can scale this up. NGOs, because they are at the forefront of innovation. There are multiple ideas that come from NGOs, hence they need to be involved. They are at the forefront of innovation. They are the ones who are going to do a lot of implementation. They would be your lead guys in case of monitoring, and they are also in some way responsible to the civil society and in terms of answering whether the impact was there or not. So any partnership must involve government and NGO. This is my personal belief in terms of success and a scalable success, so to say. The fourth important part as far as the roadmap is concerned is the monitoring and evaluation. So as you prepare, do think of what are the KPIs that we need to use to measure the impact and outcome. Without those KPIs, not only from the CSR bill point of view, but also for your initiative point of view, for it to sustain over a long term, like any other business idea, it needs to have a KPI which is measured using a scorecard at the right frequency and at the right levels. So from the ground, middle level, and till the CEO. So think about the whole monitoring and evaluation in a joint way, how the NGO is going to contribute, how you are going to probably make the government aware of the initiative using the scorecard, and how you are going to internally monitor it. So these are the 3 thoughts that I wanted to leave behind in terms of the roadmap. And again, in summary, if I were to say what are the 3 questions that I wanted to address for this group. One was why healthcare is important and why private sector should be involved. Second was what are the different models that the private sector in itself can think of to operate on. And third is what are the 3 or 4 most important things that you need to worry about between now till 1st of April, or what are the 3 or 4 building blocks of your strategy. Thank you very much.
Clearly